All this is Dr. Mobeen Sayed from drbeen.com. This is the second show for today. Welcome. And yes, Steve, you are first. I love it. So, Steve, you got your first dose of the vaccine and you are first. Jenna, hello, how are you? DDS, how are you? Doug, how are you? Third. Jim is also third. Anna is hi. Anna is saying hi. Doug is saying hi. Jenna. Jim is saying fourth. Jenna is happy Dr. Bean is feeling better. What do you think? What do you think? How am I feeling? L, hello. And then Nancy here. Steve, yes, Pfizer. Oh, wow. Pfizer, very good. Nice. Cindy, hi. Rajesh, within first 10. Good one. Rajesh, I like that. Carolyn, hi. And then there are so many beans already. So all cool beans, welcome. L was saying I was shooting for the top 10. So Chrissy says, you sound so much better. 10 out of 10. Carlos says, hi. Paul says, looks like you're feeling well again. That is nice, Paul. So yes, I am feeling well. Margaret, welcome back. Thank you very much. Ruby Zared, hello, Ruby, how are you? Jesly, Alex, hello. Irshad says, Slam. Steve, but they did just relax the temperature requirements, so maybe that's why. Temperature requirements for Breezy says, looking good, thank you. Margaret is back. Kamran Jamil says, hi. All right, so Doug says, Dr. Bean is cured. Thank you. TD says, here. Nancy says, you sound like you're already taking steroids. No, I'm taking nothing. Actually, it was so funny. This morning, France is relieved that Dr. Bean looks good. Thank you very much, France. Sorry, I've been away, haven't been feeling well. So hopefully you're doing well now. So this morning when I woke up, I did have slight, when you have post-nasal drip and you sleep, then some of that congestion and that mucus is formed here and you can feel it. So I had that tiny feeling. So I said, oh, it looks like I am actually worse than before. But actually, that was the only one thing. And that's it. I still feel slightly congested, but totally fine. There was no fever. So this morning, now Michelle is going to become upset again. This morning, I did not take anti-inflammatories at all. So I wanted to see what happens if I experiments on myself. So I wanted to see what stage am I at? Am I still going to develop fever? Will I still develop congestion if I did not take anti-inflammatory? Will I have pain of any sort and so on? So I skipped my meds in the morning and nothing. There was no fever. There was no congestion. There was no issue with the oxygenation. So oxygen stayed 98 throughout the day. That is the oxygen that I usually have. It never goes to 99 or 100. So it's always 98. So that's how it is. So here I am. So Sina says, do you have COVID? So this is something that is funny. COVID test is negative. I actually don't think it was COVID. Half of the cool bean doctors who talk with me, they say you have COVID, and half of them say no, you had some other cold. So to me, it doesn't look like it was COVID, but as I had said before, that it should be treated. Those symptoms of respiratory illness should be treated as COVID because we live in a time of COVID. So I treated it as COVID, and I'm still treating it as COVID. But this was night and day difference, ivermectin. And it is interesting. I really, really want to kind of skip ivermectin again today to see what happens tomorrow. But I'm going to take ivermectin just to continue to, finish this thing. But there is a huge difference with ivermectin. Anti-inflammatories, ibuprofen, I was taking 1,000 milligram in the morning and 1,000 in the evening. That's a huge amount. These did not have as great an effect. I was taking all of my supplements and then ivermectin. And ivermectin is the only one that really has this strange and impactful outcome. Yes, so no, I will not skip. I would take it. France says 16 likes. If you love Luffy, smash the likes. Absolutely. If you love Luffy, which now that Luffy has heard his word, is going to say, "Oh, I got my name," and is going to be here soon and um, trying to talk with everyone. But thank you. Yes. So this is how much is the difference with the ivermectin. And I talked with one of the doctors this morning, and I said, by the way, I also reached out to Dr. Antonatos, who is Text to MD, and I thanked him for his work and help. Uh, then I talked with another doctor, and I said, look, um, oxygen 98%, no fever, no congestion, slight feeling of irritation in the nose. That's all. Haven't taken any inflammatory or antipyretics, no fever. And the answer was awesome. You have beaten COVID. So she still thinks it was COVID. And then she said, I said, was it really COVID? And she said, your clinical symptoms sounded very much like COVID. Um, I would like you to get antibody tested so we can confirm that. And that is, and then I said, so now this is the sixth day. If it is COVID, this is the sixth day. So doing good with these symptoms, or still there is chance of deteriorating? And she said 100% and all healthy and good. So this is the assessment of the doctors. How is everyone doing here? And Arubaga, thank you very much. Arugba. Sorry, I keep calling Arubaga. I'm sorry. So Arugba, thank you very much for for bromhexin. And I have a gift for you as well, if I could come over and drop it. So Carolyn said, could you have had influenza? Possible. It is possible that I had some other cold virus. Mike says, my doctor said ivermectin has bad side effects. So every drug has side effects. The therapeutic doses is what is important, and within the therapeutic dose, ivermectin has it is one of the safest drugs. How many doses? 3.75 billion doses of ivermectin have been given, and any related deaths are lesser than the deaths because of vaccines for COVID. One case of hepatitis, and that's it. There can be allergic reactions. That is possible. Even allergic reactions are actually very easily manageable. Other than that, sometimes nausea, GIT, upset, and that's it. Not much. So I don't know if your doctor actually looked up. Just like my doctor says the COVID is like common cold. It should just go away. So doctors are funny nowadays. Rajesh says, question, shouldn't immune system be challenged once in a while? Yes. So it is so funny. One of the doctors who was consulting me during this time, she said that I allow my kid to eat something that is dropped in the floor so he continues to develop immunity. So immune system should be challenged. There is a hypothesis or theory of which is called hygiene theory. And what that says is that folks who live in developed countries or cleaner countries, their immune system is less busy with viruses and pathogens, and it is just sitting around, and sometimes it just attacks them back and causes autoimmune diseases. Or when there is a disease like COVID, it just does not know how much to attack or not, and it just goes overboard. So those countries where the immune systems are busy with the dust and the pollutions and the viruses and pathogens, their immune system is a little more balanced and little more trained in behaving better. This is just a theory. I don't think it is really important. Eat dirt. Denise says yes. Heather, after my second Moderna vaccine, I was very nervous, nauseous the next day, and had swollen glands. So, Heather, how are you doing now? Michelle says, good, let them eat tuberculosis and hate tuberculosis and versa. Yeah, no, tuberculosis is really scary. Arubaga. So, Arubaga, I was actually pronouncing correctly, Arubaga. I had slightly faster bowel movement the first time I took ivermectin, very minor. Yes. I didn't even have any effects. Barbara says, pardon my bluntness, but it may be the case of denial and overdependence on fallible PCR test. I don't know if it is. Do we need to change your primary care doctor? Yes, I know. Do I really need them? My apologies, but many times it's... William says, I took vaccine 2 days ago and plan to get antibody test, but read that it won't detect antibodies from vaccine. Is this true that an antibody test won't detect vaccine antibodies? I have heard that many times as well. I think that is a rumor created to stop people from getting their antibody test, especially when they were under trials, so that they do not know if it is saline versus the actual vaccine. But if we think about it, here is how the thinking will go for this one. So let me share my screen. So we know that here is the virus, and let's say this is the spike protein, and the spike protein is something against which we are making a vaccine. So the antibodies are going to be against the spike protein, correct? Or some parts of the spike protein. We also know that the testing is, what I understand, the testing is actually looking at the spike proteins as well. So the messenger RNA is, we are making in the test, we are making messenger RNA. I'm trying to figure out vaccine antibodies versus test antibodies. So if we have a antibody test, in that test, normally the test is also looking at the antibody for the spike proteins. And they actually look at least 3 antibodies for various parts of the cell. And these are called signal areas. So let's say they are always looking for this part of the antibody that attacks this part, and they're looking for antibody that attacks this part, and they're looking for antibody that attacks this part. Now, it is also possible that they have an antibody, they're looking for an antibody that attacks the N part, which is inside the virus itself. It is also possible, let's say, that they are looking for a antibody that attacks M part or matrix part here. These are all unique parts. So it really depends upon the kit. Most of the kits favor detecting antibodies that are attacking the spike protein. So now let's say you have given someone the vaccine. This is the vaccine. Now, vaccine causes the antibodies to be produced against the spike protein, of course, but not against the M protein or N protein or other parts of the virus, which is natural because the vaccine, the RNA-based vaccine is only making spike proteins, or the adenovirus-based vaccine is only making spike protein. Inactive vaccine, like Covaxin from India, that is bringing in the whole virus. So that is a different situation. So if we have a vaccine against a spike protein, then the antibodies that we can detect are going to be only against the spike protein and not on the other parts. So now let's say if you have a test that looks for antibodies against M proteins, then the test is not going to detect antibodies against the spike protein. Or let's say the test is looking for, as another signal, antibodies against N proteins, nucleocapsid protein, then the spike protein will not have N proteins in it. But those tests that are honing in on the antibodies that are against the spike protein, they will pick it up. So it really depends upon the test's own signals. I thought majority of the tests are actually looking at the spike protein antibodies. If that is the case, then when you are vaccinated, your antibodies should be detected by the antibody test. Carolyn says, I ate dirt too, and my mother always said I had a cast iron stomach. Interesting. Zakir says, one of the patient had twice negative PCR 5 days apart on day 10 and 15 was negative, but HRCT test revealed 40% lungs involved. Was treated as COVID. HRCTI is mandatory or not? So this seems to be an exception to me. I don't think that this is a case that is true for everyone. But if somebody has clinical outcomes that are severe, and we know that oxygen level dropping below 93, with that there is fever, with that there is dry cough, with that there is, let's say, within 24 to 48 hours, more than 30-40% of the lung is getting involved, then all of those are actually important things to hospitalize someone. So in this kind of a situation, HRCT or chest x-ray are important to understand what to do next. So it really depends upon the clinical state. For example, look at me. Let's say I have COVID, or I had COVID, and now I am on the 6th day. Would you send me for chest x-ray or HRCT? In my opinion, you do not need to send me for that, because clinically I am looking okay. Let's say tomorrow, God forbid, I start deteriorating and my oxygen starts dropping. Now you have two ways to look at this thing. One, you already know that this person may have had COVID, so you know it is COVID that is causing it. So you still maybe just need to do a baseline to understand how big is the damage and just start treating. Or you send for the HRCT and chest x-ray. So it really depends upon the clinical picture and the history of the patient, how much you know. For example, you get somebody in the ER today, you do not know their history and they're short on breath. Yes, for sure, get their x-ray and HRCT to understand what's going on. So Anthony, how are you doing? So TD says CNN, NPR citing Columbia study proving Evamectin useless. I can look it up. These these organizations have not done any decent work anyway. So let's say Columbia study Ivermectin. So 10 hours ago, let me share my screen as well so you can see what I am looking at. Okay, so this is March 4th. Effect of ivermectin on time to resolution of symptoms among adults with mild COVID-19, a randomized clinical trial. Finding: in this randomized clinical trial that included 476 patients, the duration of symptoms was not significantly different for patients who received a 5-day course of ivermectin compared with placebo. Median time to resolution of symptom 10 versus 12. Hazard ratio of symptoms was 1.07. Do not support the use of ivermectin for the treatment of mild COVID-19, although larger trials may be needed. Double-blind randomized trial conducted at a single site in Cali, Colombia. 476 symptoms. What was the dose? Intervention: 300 microgram per kilogram, which is a good dose, per day for 5 days, which is also very good, or placebo. So at least the treatment was fine. And they say they don't see any effect. Very interesting. Yeah, so from at least this study's point of view, it is useless. There are many studies which also show it is useful. I have to look deeper into the study, but at least from the data which I'm seeing here, yes, it is of no use. I would actually present to you, this is not a study, but I'll present to you myself. My number of symptoms days still stayed the same. But what I thought was that ivermectin just kept me hovering at a outpatient like status and did not let me deteriorate. Chuck Becker says, I wish Big Bean was my not doctor. He is so caring, asking us about and our wellness and condition, these random chats with the cat sessions. Absolutely. Cat is important. Cat is the one that is the breezy one says, stupid studies are set out to find what they want to find. Yes, there are studies that would bring you what you want. Zelena says, do you think CNN has been bought? I think that bought or not, CNN is just looking after their own need. When, so some of my team members have said me not to say this, but I'm going to say it now. Since when is Sanjay Gupta? Sanjay Gupta is their guy, right? A surgeon become an expert on medicine. Am I right? Yeah. And I am fine if we said that, hey, he does a lot of research and does work with that. But in hydroxychloroquine time, there were so many studies that were proving that hydroxy was working. He would ignore all of them. If you look at my previous videos, there were many times, just like now, I looked at this study and I said, well, looking at this study, it does say that it is useless. I did not say that, well, it's really bad and these guys are bad and they must be shills or they must be that. I looked at the data and I said, this is how it looks, fine. I need to dig deeper into it. And then there are studies that show it works as well. I never heard that kind of balanced statements from him. He had chosen a corner. Why did he choose that corner? In my opinion, he chose that corner because CNN chose that corner because Trump had used the word hydroxychloroquine. So CNN naturally took the opposite stance. Maybe they were just misguided or misinformed or less competent for medical data and not against Trump. So they decided to go against hydroxychloroquine. And then all of their team just kept looking up things that they can say against hydroxy. That I think is wrong. News media should provide the news and be done with it. And anyways, and I see the same with the Fox as well. When Fox goes haywire with their corners, they also make up things that just you listen to those and you say, where did you come up with this medicine? So they also have their own agenda and they go in their own corners and just look silly in those corners. So Paul, how's my wife and son? Fine. She was actually better before me, and my son didn't even have anything. Although I put them all on ivermectin, but my son did not even exhibit any signs of fever or cough or anything, nothing. Jim says the veterinarian will probably tell you that the cat can't have ivermectin until the cat goes to the hospital. CC says, after Gupta and Fauci, I'm so grateful to find you. Thank you very much. Okay. Question, John says, if I were to get the Moderna vax and I unfortunately turns out to be one of those 6% that its efficacy doesn't cover, what exactly are my T helper 1-2 cells doing or not doing? So it's not really just the T cells. Let me draw it and explain. When a vaccine is not working, what does that mean? And that is true for the virus as well, and vaccine or anything else. So what happens is, let's say that we have the vaccine, let's say it is a lipid nanoparticle, it has arrived fused with our cell messenger RNA in the cell. Then that causes the ribosome to be attached with it. That makes the spike proteins. The spike proteins are then supposed to be shredded and presented on the surface. This would then cause the helper cells to be connected with it, and then they would start the immune system. T helper 2 here, T helper 1 here, and the responses. This can fail if this area is either not activated, which will be very difficult in a normal, healthy individual, or it is activated and is making antibodies in insufficient amount, which is possible in healthy individuals as well, or antibodies against a part of the spike protein that really is not covering the actual virus's spike protein correctly. So when the actual virus arrives, the spike protein that is the antibody that is produced here against the spike protein is connecting with that in such a way that the virus doesn't even get bothered by it. So, or maybe the memory cell did not form correctly or insufficient number. This is called energy, and it is a normal process. It's not a pathology. Energy means sometimes our immune system just is not bothered by something. It just ignores it and says, you know what, oh well, whatever, I don't care. So this is energy, where there may be less sleep memory cell, there may be less production of antibodies, there may be less cytotoxic cell activation, there may be less T helper cell activation, there may be antibodies produced at a place of spike protein that is not what we want. This part is not energy, but this connection and then cells not responding correctly is called energy. So in some people, they would just not be bothered, or they would not be trained correctly by the vaccine. And that does not mean that there is an issue with the person's immune system. It is just whatever vaccine produced is not the right thing in them. This is why in such folks, maybe the inactivated virus, which is the whole virus, and then a broader spectrum of antibodies are produced, may work better. So Nairi says, did he say Moderna or Pfizer will protect against this new dominant strain? So the at least the strains that we have so far, Moderna and Pfizer's efficacy has gone down a little bit, but they're still protective. And Moderna is already trying to get ahead of the situation, and they are creating a cocktail where they would have the RNA of the newer strains as well. So their vaccine would cover both. Mariasa says, whoever the two who are hitting down button did so on first one and this one, and they haven't heard the whole lecture. Why? So there are actually some folks who would just religiously just come and do a down button. So Mike says Trump got vaccinated in January. I think he was eligible. Linda says, so what's against the RNA? Linda, I didn't understand your question. Roller Girl says, please like this video. Yes, smash the like button. Luffy's also, France is also saying, 89 likes, Luffy's unimpressed. Yes, Luffy just provided his opinion and went. Steve says, I just took a look at my arm in the mirror. It's not even red at all. Yeah. And that is fine. It's okay. A lot of people do not react at all. Arubaga says there was a labeling error in the JAMA trial. It was a mess. Arbaga says there was a question here. HI says, do you believe masking is really necessary with the second dose? With the second dose of the vaccine? So after the vaccination or after getting the actual infection and recovering from it, ideally mask or vaccines or those things do not matter anymore. After that, it is mostly you being courteous to others to say, I'm wearing a mask, so you don't have to ask me that why aren't you wearing a mask, and then I have to explain it, and then you have to doubt me, and then so that is really up to you. There are going to be some folks who are not going to wear a mask regardless if they had the infection or not. I had a comment yesterday by some maybe slightly lesser cool bean, and they said, well, I don't want to be mean about it, but of course, if you've gotten COVID, I'm paraphrasing them. If you've gotten COVID, you've been wearing masks religiously. So that means COVID can be gotten by wearing mask as well. And I was cracking up. When I used to work with the teams, engineering teams, sometimes some engineers would come over, especially with the PCI compliance, with the data security compliance. And they would say, this server doesn't have encrypted, let's say, social securities. And when I would say, why does it not have the encryption here? They would say, well, that server over there has been sitting there and that also does not have encryption. And I would ask them that, does this mean if there is a proof of something incorrectly done, does that mean we just continue to do that? Or if somebody breaks in to my house after breaking a window, should I now start leaving all the windows and doors open because one of them was breached? So masks are never 100%. So even let's say I got the COVID after wearing a mask, that means we need to double down on keeping the mask. That it is even dangerous that even with mask there can be a possibility of COVID. So instead of saying, you know what, just leave it and not have masks, if everybody had stopped wearing masks, we would have a huge problem at our hand. We will see how Texas does. It would be interesting to see. Maybe it would actually work out. We'll see. Yes, so Heather says companies won't be able to keep up with all the variants. So for me, it is very simple. Number one, ask people to wear masks. Number two, have social distance. Number three, give everybody Evamectin, or give them hydroxy and zinc if they like that more, or Evamectin, whichever. Correct everybody's vitamin D. And for a majority of the cases, things will be better. Nairi says, Dr. Bean, which vaccine should I get? So you're fortunate that you can actually decide, hey, I want to have Pfizer or Moderna or AstraZeneca. So I like Moderna. I like Pfizer as well. I am waiting for Novavax to see how that is, because Novavax is actually the spike protein itself, and it is not RNA or DNA, which would go into the cell and make spike proteins. But we do not know the results yet. David says, do you think that the mask can reduce the viral load? Absolutely. TD says that Texas will spawn variants. I think so. Hey, Luffy. What are you doing? Luffy, what are you doing? Luffy, are you playing? He's playing at this time. So we'll see what happens. Mike says, I'm happy with Pfizer. Pfizer is good. Carolyn says, question, once completely vaccinated, the virus shouldn't be able to replicate in your body, correct? In that case, why are they saying the virus can still be spread by the vaccinated people? Okay, very good question. And let me explain it. So I'm going to share my screen. And let's say you are vaccinated, right? So, and you have, let's say 14 days after the vaccination, you are fully protected. So that means you have B cells sitting somewhere and sleeping. and these B cells are ready that as soon as um, the virus arrives, they would start making antibodies. There are some T cells sitting somewhere as well, and they are sleeping as well. And they're also waiting for the virus, right? So they're all in Zen mode and they're waiting. Now, what happens is, let's say the virus arrives, Luffy. So let's say the virus arrives in this person's mouth, right? So here is a mouth virus. The virus has the first hindrance for the virus now is going to be the presence. So let's say this is cell layer of the mouth, and then with the cell layer is the mucus or the fluid layer as well, correct? In this fluid layer, we have lots of IgA present, correct? IgA are present. So some of that virus is going to get lodged with these IgA that are kind of capturing, arresting it. So lesser viruses are going to get a chance to actually enter the cell. But let's say some viruses will enter the cell as well, and we have become infected. Now this cell, the virus is going to get into our cell, is going to start replicating, and it is going to come out of it just like normal. However, remember that the load was reduced already here. Secondly, within 24 hours, so it takes about 24 hours for our sleeping cells to notice that there is something wrong happening and start reacting. Meanwhile, innate arm is still working, so the virus would be still in check by the innate arm, macrophages, dendritic cells, and B cells. But then these cells would wake up as well. Now remember, in normal, non-exposed person, these cells will need training and be activated, and that can be 7 days or 14 days or even more. Here, within 24 hours, they'll wake up. And within 24 hours, then they would start attacking the virus-infected cells and the viruses and start cleaning them up, start making antibodies, and just take care of the virus. But within that 24 hours, there is a possibility that the virus that is replicating is going to be shed out. Now, a majority of the virus that is going to be shed out will have immunoglobulin A attached to it. And that is a good thing, because even when the virus is getting out of our mouth, it is still coated with the immunoglobulin A, and that is less effective virus. But for 24 hours or whatever is the time for the sleeping memory cells to wake up and start functioning, till that time, virus is replicating, not that bit more in amount, but replicating and getting out. This is why they say that even after vaccination or even after getting an infection, you can still become reinfected and spread it, but still not become sick with it. I hope that answers that question. Chuck Becker says, got both jabs, still on Evamectin, and all 2 dozen supplement, wear 2 masks and a freaking face shield. Yes, good one. Mike says, Luffy has COVID. No, Luffy has been quite healthy. Doug says, Luffy needs mask, Evamectin, and Haldol. I think I should have him all of those things, and we should take his pictures. Roller Girl says, how young is Luffy? I think Luffy is 6 years old. So Wayne says that you're free to do whatever you want. It says that the state will not force you, which is fine. B12 says quercetin lowers my blood pressure. It can. Quercetin is known to lower the blood pressure in those who may have slight elevation of blood pressure. Samina says Luffy needs mask. Sure, I'll have him wear a mask. That will be interesting. So Roman says, Dr. Bean has said that you don't need the vaccine if you had the wild virus. I don't understand those that still get vaccinated. And I still believe that. Luffy, what are you doing? Luffy is quite smart. He knows that I'm going to pick him up, so he just stayed away from me. And once he knows that I'm off of this seat, then he would come near me and he would be a little more. He ran away again. Okay. Oh, so here's the deal. If you have the infection and you developed the response to it and you took care of it, then the vaccine is what, a tiny drop compared to the virus itself spreading and dividing in our body. The only reason to take the vaccine could be if there are so many new variants that the variant that had infected you has become an old story, and we've gone from, let's say, SARS-CoV-2 to SARS-CoV-3, or if your own immune system and health has gone down, or you have become immunosuppressed, and that is the reason that now your developed immunity cannot handle the virus anymore, and we need to kind of bother and boost the immunity again. So now Luffy and Kyrie both are playing. Dave WBK says, theoretically, how soon could someone get vaccinated after COVID infection? You can get vaccine. And look, COVID infection itself is a vaccine on daily basis, right? Let's say that you are taking care of it correctly, meaning you're not becoming sick to the point of dying. Then your body is just reacting to a virus that is in there, and it is fighting on it with it on daily basis and creating more antibodies and more cells and more number of cells and doing affinity maturation and creating memory cells. And that fight is just continuously occurring. Imagine you're getting a dose of vaccine every microsecond, and that is just bothering your immune system, and immune system is responding. There can be no vaccine that can really behave that way, the way the actual virus does. So then, even during the disease, if you get the vaccine, so what? Our body's going to not even bother about it because it's nothing. For what body is fighting with, vaccine is nothing. So you take it during the infection, or you take it a day later or 2 days later or a week later, doesn't matter. I think what is interesting is going to be, let's say a year later, the SARS-CoV has converted into SARS-CoV-3. Now you may need to have a vaccine, or the variants have become too different from original. Then a vaccine may make sense. LD says, is there any data on long haulers getting vaccine and side effects? No, I haven't seen that data, and I'm looking for it. I was looking for that as part of the long hauler discussions that we were doing. And if anybody has that data, or any link, please share with me, because I still want to continue with long haulers, and that is one more thing that I want to discuss. So Termite 15 says, so Dr. Bean have COVID? I thought he said he had a cold. So the result is negative. Half of the doctors who speak with me, they say I have COVID. Other half say, no, you just have some other cold, but still manage yourself as COVID. So, so it is still a mystery. The right thing to do next is that within 7 to 10 days, I should do the antibody test to see if the antibodies are produced. If that is the case, then I may have COVID. Excellent. So LD says, my brother-in-law was told 3 months after he had COVID. I do not know what their rationale is. They're expecting that in 3 months. Here is what would happen. There is a study, and we talked about it. There was a study that the antibody titers go down after 3 months, and the levels are lower. And that makes sense because our body is not actively fighting against the virus anymore. The memory cells have gone to sleep. They are not really functioning that high or that actively. When the actual virus would appear again, then they would start waking up and start functioning again. So I think doctors are making a theory from there, deriving a theory from there to say, well, If after 3 months the antibody levels have gone down, then it is useful to get the vaccine. Well, if we use that um, thinking, then we would need to have vaccine after the vaccine's third month as well. And it is even bizarre for me that I actually remember that doctor with the bow tie. He had said the vaccine will produce immunity for years, and the actual infection cannot produce immunity for years. That is such a BS to say. Why is vaccine superior in creating these versus the actual virus? I understand that the vaccines can be modified, the RNA can be modified, they can be adjuvants that would bother the immune system, and you can kind of trigger and poke, but still, actual wild infection, we are talking SARS-CoV-2, that is so intense that it can kill people. And then you're saying, well, vaccine does a better job than that. Actual infection is so dangerous that I would not want to have the actual infection. I would rather have a vaccine. But vaccine and actual infection is far more potent. LD says, I love the way you think, Dr. Bean. You cut right to the chase. That is so right. Thank you. You're welcome. Francisco says, Dr. Bean may very well go the ATH1 pathway and does not develop antibodies. Yes, it is absolutely. And there are so many people who, after the infection, do not show antibodies because they've gone TH1 pathway and their cytotoxic T cells are working. You are very correct on that. M. Gregory says, my friend had COVID, recovered, and is traveling out of the country for vacation. Is this safe? Got COVID, recovered, and traveling. Yeah. So here is where I would find slight nervousness. Let's say you get COVID in the US. So majority of the strains are from here. Then you go to South Africa, where these vaccines are not working. So possibly if the spike protein is too different, one might actually get infected again. But that is just me being nervous about it. Otherwise, yeah, it is safe. And I would keep repeating this. If a person's own health status has not changed, that means they have their memory T and B cells. They have the cells active correctly. They have their bone marrow working correctly. They have their lymph nodes working correctly. Then they're fine. But if the health status has changed either by medicines, for example, immunosuppressants, or by some disease, then it would need to be assessed again. Siddhartha says remdesivir has little effect on the hospital. Yeah, this is known from a long time, Siddhartha. You're absolutely correct. Remdesivir doesn't do anything. They keep selling it. James says, why do all mRNA vaccines, with exception of AstraZeneca, use perfusion-stabilized spike protein? So the thing is this, that the spike protein that they want to generate. So remember, they do not have the spike protein in the vaccine. It's just that they have messenger RNA that would produce a spike protein. They want the spike protein to sustain long enough to be able to create antibodies, and they want the spike protein to have enough epitopes that when antibody is produced against it, that antibody would be good against the actual virus as well. So that is all they are trying to do. The different technologies, for example, Moderna says that the way they built their technology, they can work with the lower temperatures, higher temperatures than AstraZeneca, and so on. Interesting. Colin Hamill says, is there a chance that there are more than one diseases out there that are getting deemed to be variants? Possible. Maybe there is a SARS-CoV-3 out there. Maybe there is a totally different kind of a disease that is being called. You're right. Possible. Rico USA says, what is considered a safe dose of ivermectin? Recall that NIH was concerned that ivermectin success in vitro was at least 100 times safe for humans. Is safe? My guess is that it is quite a bit more than 0.2 milligram per kilogram. So I wanted to do one more experiment on myself. That experiment was to actually divide the dose in 12 hours and then see it, because what happens is the whole day my nose is actually fine. Now, ivermectin I take about 9 o'clock after this chat. Then I go and have dinner. Then after that, I take ivermectin. So it takes me about another hour, about 8 o'clock. So somewhere near 4 or 5, my nose starts getting congested. If it is because of ivermectin that it was stable, then that means the effect is reducing. That means either the dose is less or the division of the dose is less, because if the half life is 18 hours, then even if I take 10 milligram, it is going to be 10 or 20 or 30. The half life is still going to be 18 hours, unless we overwhelm the GIT and sorry, the liver to detoxify the ivermectin or to modify it. So the dose that has been seen, of course, has not been seen to be the way they used it in that study. But why I talked about my dose is that even at this dose, it was very effective. And at least for my own experiment, I saw that if I left it for one day, the response, the body went down so fast that I was surprised. So that means it was an effective dose. So lower part of therapeutic dose has been very effective as well. And we are seeing all studies, most of the studies are using zero point 0.2 milligram per kilogram and above, just like we saw 300 milligram per kilogram. And these studies are showing good results. So I don't think that this particular message from NIH is very, they are just being disingenuous by doing these kind of things. LD says good night. Good night, LD. David says SARS-CoV-2 does not have a mechanism to evade antibodies unless it mutates too much. Rajesh says, is ivermectin fat soluble or water soluble? Very good question. So I think it's not about the solubility of it. If you give fats with ivermectin, meaning you eat it with fats, then ivermectin with fat, maybe it is fat soluble, we can say, it becomes absorbed in the GIT more and becomes available in the body more. On the other hand, if you take it with less fats, then it stays more in the GIT lumen. So if there are any worms in the GIT, it would go and attack them more. So it really depends, what do you want to do? So from this, what I just said, you can say it is more fat soluble, but we don't usually say it that way. We just simply say, if you take it with fatty food, the bioavailability is better for the body. If you take it on empty stomach, then the availability for the GIT is better, but not in the body. TD says that sometimes I take 3 milligram with fat. 3 milligram with fat. 3 milligram is very tiny amount. 3 milligram means, I'm opening up my calculator, 3 milligram divided by 0.2, 15. So 15 kilogram multiplied with 0.2. So 15 kilogram person should take 3 milligram. A person who is 70 kilogram, so 70 and lower part of the therapeutic dose multiplied by 1.5 is 10.5. So about 11 milligram is necessary for 70 kilogram person. Gurav Shah says, what are the chances of a person who has recovered from COVID-19 getting too serious from a different variant of the virus, and is death a possibility? So I would say it this way. SARS-CoV-1 could cause issues with SARS-CoV-2 can cause serious disease in SARS-CoV-1 patients who had recovered from one. And their similarity is about 86%. SARS-CoV-2 variants so far are not so bad that they can cause severe infections. It has been seen in some reinfections, the reinfection was more severe than before, but majority of the reinfection have been less severe than before because our body is primarily trained against that virus. So it knows the majority of the virus. Maybe it doesn't know one or two parts that are changed. So ideally, the response next time should be lesser. We should not even know that this happened. We are all whoever got COVID and has recovered will get COVID again and again and will not even be bothered because we would not even know it arrived in our body. So ideally, the possibility of death should be less, but there have been reports of reinfection where the event was more severe, but that these are very less in number. Most of the time, reinfection is less severe, even if it is by a variant. So this is important, Denise, but then why did the variants in Brazil? So it really depends that what is the kind of variant. So this is what was in my mind when I was talking about some variants have caused more disease. Brazil, there are variants that are actually causing more disease. So it really depends upon the change. The question is, will they be so intense? Would they just cause more disease and more spread? That is fine. Will they be more intense in severity, leading to death? I think that would not happen. John Ray says, should I include a Moderna taking clause in my prenup for my fiancée? She's a no vaxxer. So you are going to have a prenup? So that is the first question. So this is, of course, your decision. What do you think, Cool Beans? Except in Manaus. So I would actually, Denise and Ehsan, I would look into Manaus once more to see if that is happening or how intense is the new variant. Cool. Paul Borg says, I would steer clear of the prenuptial advice. Jody says, a question, if a test doesn't recognize a new variant, why would the antibody test? If a test doesn't recognize a new variant, why would the antibody test? I didn't get the last part, Jody. Why would the antibody test? Can you elaborate a little more? James says, don't marry an anti-vaxxer. And if Pasi, you are watching, thank you very much for your comment. I read your comment. I hope you're doing okay. I hope you're not that frustrated. You're welcome here with whatever are the beliefs and whatever way you think about the healthcare. I have never ever pushed anyone away, unless there's some folks I've blocked here who just become very abusive or cursive, but you have been such a pleasure and joy to have with us. Rajesh says, whatever floats your boat, yes. Stephen says, I appreciate your sense of humor, enlightens your lecture. Thank you. Mike says, I wouldn't marry an anti-vaxxer. So that reduces the chances a lot, isn't it? Logic says, can severely anemic people get the vaccine? Yes. So look, question is, why is the anemia present? Anemia can be present because there is, let's say, iron deficiency, very common in women of menstruation age. So in such cases, bone marrow is working fine. It is making B cells and T cells and natural killer cells and megakaryocytes and all those things that are necessary. But because of menstruation, woman is losing blood and maybe she's not taking enough iron. And so the B cells are not made in correct quantity. Such patient has correct quantities of the B and T cells, so taking vaccine is fine. Same is the case with the folic acid. Now, folic acid B12, when there is anemia there, that is also an indication that the rest of the cells are probably not going to be in great numbers as well, because the folic acid and B12 are necessary in helping make the DNA of the new cells. And when they are less, the DNA does not, imagine the brain of the cell does not develop fast enough. And so the number of cells that can be developed are lesser. So anemia would occur in such patients as well. And then if you give them vaccine, they may have lesser immune system cells to work with the vaccine. So they may not develop as potent a response as somebody else. Then let's say anemia is because the bone marrow is not functioning correctly and it's just not making cells correctly. Then giving a vaccine would not be as potent as well. So really it depends upon what is the cause of anemia, and that would decide how would the person respond to vaccine. Still, they should get the vaccine. Is Japan here? I see people thanking Japan. I didn't see Japan. Oh, here, Japan. 5 allies supplement. Very good. Scott says this sounds like it will never go away, I'm afraid. So Scott, I actually think about that as well, and I think it would go away. SARS-CoV-1 went away, MERS-CoV went away as well. SARS-CoV-2 became too widespread, and it has taken advantage of all of us, yes. But we are also developing herd immunity against this. Number one. Number two, we are learning how to manage these viruses very fast with ivermectins or hydroxys or vaccines or masks or whatever. Eventually, we will defeat it. We will know what to do. It would become a simple thing for us. The very first time when it attacked, the world never knew how to handle this. Now we know how to handle this. And I think what would happen is, let's say if SARS-CoV-2 becomes SARS-CoV-3, I can bet that there are going to be countries that would handle it so easily. And then there are going to be countries that would not be able to. That is more of a learning and adjusting. But we will adjust and learn from this. Even if the big pharma is kind of tampering with our systems at this time, at least in the US, if it becomes SARS-CoV-3, I don't think people are going to let big pharma continue to do this. So we'll be out of it. Vitamin D levels will be corrected. Ivermectin will become more prevalent. We'll be out of it. The cost of non-reaction is a lot at this time. That is the problem. People are dying because the reaction, the right reaction is not available while it is cheap to do. How difficult is it to ask someone to have better vitamin D levels? How difficult is it to open up ivermectin and say, hey guys, we don't feel it is great, but if you think it is useful for you, go ahead, take it. So that is what is baffling. So I think that in next 2 to 3 months, we will be back to normal. Colin says that in my opinion, it is the most politicized disease ever, even more than MERS or Ebola. Yes, you're correct. And it has caused so much damage as well. Doug Gross says, is it okay to drink while watching? So it depends how much and what would that change us into. So Barbara, that is the basic problem. Look, we knew about vitamin D a year ago. What was so bad? So I keep getting mad because I saw an ad by CDC saying that it is your call for vaccine, but vaccines are safe and blah. And so they had an ad. If they can have an ad about vaccine, they can have an ad about vitamin D, and they can say the same thing, that we think it is safe. We think you should take it. It is still your call. Talk with your doctor, see if you can correct it. I was shocked. Maybe I actually thought too much of the US leadership, medical leadership. I thought too good about them. I was shocked when I found out that they would not allow a vitamin D at home test, even when that Kivano test people, that test was good or not good. If they were not good, somebody else would come in with a good test. But they should have allowed the home tests. They should have allowed the antibody. Don't you think that at this time, I should be able to have a COVID-19 antibody test at home to see if I have it or not? And if I don't have it, I stay more careful. And if I already have it, I at least know that, oh, all right, I'm protected. What is so bad in doing that? And you cannot have antibody tests without a doctor's prescription. And for a doctor to prescribe, so somebody comes to me and says, I want an antibody test, the question is why? If you ask a doctor that, hey, I want an antibody test, they say, well, why do you want an antibody test? So the only thing is going to be, well, I want to give plasma, or I want to donate blood, and so on. So people have to now come up with lies because right and natural medical tools and levers are not offered. That baffles my mind. Jem says, Dr. Mubin, I have a procedure tomorrow. Will Evamectin interact negatively with worse than fentanyl? No, I don't think so. No. And good luck. Hope the procedure goes well. Carolyn says, I found vitamin D tests online, but they won't send to New York. And that is another issue. Look, vitamin D test, just like blood glucose test, can be done at home, the whole of it. And we can say that, hey, Kivano's quality was not great, but I think it would refine if you open up the market for vitamin D tests, just like sugar, blood glucose tests. There are going to be companies that would come in with better tests. They would just not open it. Emily, my own wife, when she went for, so I'm becoming so animated now that I'm hitting the mics and stuff. My own wife, and she went for her doctor for something, and eyes related, and she talked about, I'm taking supplements. He simply shrugged and said, they are useless, but if they make you feel better. This is such a insulting statement. It actually shows a doctor's ignorance and let me not use the other words. It shows that how ignorant the doctor is, that they do not know what supplements do. And secondly, how indifferent they are, that they don't care when they say it doesn't work, it is a waste of time. Even if there is a psychological benefit of it, they should let that happen. This is how bad doctors' behavior is. And Barbara, not only this, so Adam has a question. I had COVID-15. I am scheduled to get the Moderna on 3/10, 65 days after my initial infection. I'm still a long hauler with shortness of breath and high heart rate. Should I get the vaccine? I am IgG positive today. Vaccine is not going to change anything, but maybe, so I'm just going to theorize something to say, sure, take it. Number one, because you had the actual infection, vaccine is not going to do much. But maybe some adjuvant in the vaccine, some stabilized protein structure of the vaccine may trigger some part of our immune system, which may attack if there is any resident hidden virus and clear it out. So there is no bad thing in taking the vaccine. So if you like, talk with your doctor, you can take it. So yes, Barbara, you are correct that statement. My own doctor telling me that COVID is like cold. My doctor telling me COVID is like cold. So I said, this was so funny for me. So I said, do you prescribe lenivimab? And he said, well, if there are the eligibility, so for cold there are no such eligibility. So he was just kind of contradicting his own statements. And then I said, do you give remdesivir, or do you give Regeneron? And he said, well, all of that is if you're sick enough that you end up in the hospital. And so he himself this was his pre-canned answer. So this is happening everywhere. William, thank you very much. Question, Dr. Bean, did you ever get any clarification on why the rise in cases in death in Peru? Peru, my wife corrected me, saying Peru, not Peru. So Peru, if anybody is upset, my apologies. I called it Peru before. It should be Peru. Okay, so yes, William, the update is that in December, the new president restricted or limited the use of ivermectin, and that is when the ivermectin was taken away, and that is when the cases and deaths started rising again. With that, there have been some cool beans from Peru, Peru, who have sent me messages that, hey, ivermectin is useless. We have taken it, our friends have taken it, and they got COVID, and it is useless. It's doing nothing. It's just, and I think that we should be mindful of this, that ivermectin, I don't think anything, mask or ivermectin or hydroxy or vaccines or remdesivir, I don't think any of these things is 100%. But the question is, how good is the efficacy? There is efficacy in there. So Dave says, pros and cons of using NSC. Dave, I have done a complete video about it. Integrity shines. Peru. What is the right pronunciation? Somebody should tell me. Is it Peru or is it Peru? I would pronounce it. If the pronunciation is something else, actually, you know what? I should check the pronunciation right now. So pronounce Peru. Let's see.
Peru.
Peru. Peru.
Peru.
Peru. So that is what it is. No worries. I learn to this date. I learn, and I love to learn. That is correct. Lynn, your wife is correct always. You think I don't know that? Because of that, I have been trying to change my pronunciation. Peru, yes. Yes, so Barbara, I will have to change my doctor. I actually just don't care for him anymore. I just, yes. Jamie says, I love the way Dr. Bean pronounces things. It is endearing to me. Thank you very much. Not much endearing to my wife, who then corrects me. So Adam has a question. Okay, Dr. Bean, thank you. But if I do get the vaccine, is there any worry of it worsening my condition and making a possible cytokine storm, since my infection was only 65 days ago? So one, you know that I cannot answer this specifically for you, because I have no idea of the history of you, neither am I your doctor. So it will be incorrect for me. So if I talk in hypothetical terms, let's say if I get infection today, my body is now having the virus replicate again and again in my cells. coming out of them, then entering the cells again, and then replicating again and activating the immune system. And this cycle repeats and repeats and repeats. Imagine just this one part of cells over here are probably making enough of the virus that is like the vaccine. 65 days ago, when you became recovered, yes, you are a long hauler, but still your body reached a point of saying, I have defeated the virus as much as I could. Your body defeated it at that time. You didn't develop cytokine storm. You developed some other immune system dysregulation, or maybe immune system just didn't care for the virus and virus is now hiding somewhere, which I believe is lesser the case, but let's say it is somewhere. Now, if a similar thing is given again, what will it do to immune? It cannot, immune system cytokine storm will only occur if my body continues to have the virus more and more and more and more. And if I have gone through this infection once before where this happened and I didn't develop the cytokine storm, I will probably not develop the storm again. So still, if you, for example, if I am the one, I would not take the vaccine just because I don't think it is useful. My only reason to say maybe I should try this is to think maybe vaccine may have something different from the actual virus that might bother my immune system, trigger my immune system in a way that anything hidden may become removed and I would recover. But that is the only hope that would drive me to a vaccine. Otherwise, I won't care for the vaccine. But that again is for myself. William says, James Mellis, I just took the shot 3 days ago, and honestly, I'm still a little nervous. Williams, how are you doing, though? So Dave says, being in California, are you worried about the variants popping up? Yeah, so we already have the California variant is 40% or more of the cases. James Mellis, I was ignoring this question. Apologies. If someone dies 3 days after the vaccination, what investigation should be done, if any? So, of course, their history is very important. Then understanding the blood situation, the thrombocytopenia, platelet counts. So the blood counts. Then the cause of death will be very important to understand. That does that have anything to do with the hypercoagulability? Does that have anything to do with the liver or renal failure because of the cytokines? Otherwise, a person who's dying would develop failure of these organs anyways. So really, it is the immune system's profile and the blood system's profile of the system will be very important. So Norcasham says to wait 6 to 8 months before you take. Yeah, because they're thinking that by that time the antibodies have gone and the effect of the original virus infection is gone, and we need to have vaccine. Joanna says, Dr. Bean, I could tell you stories about MD ignorance in upstate SC that would make your hair stand on end. Evamectin for what? I know. I have been with MDs. I have taught MDs. Thank you, Mike. Cool. So there is one more question. So let's do a couple of more questions and then we break for today. Chicago Bean says, good name. Question, Dr. Bean, have you talked about the studies showing that some antihistamines lessen viral load of C19? Yes. So if you please go back in the in this, I think we have talked about one antihistamine as well. France says 179 lazy beans, face palm. Paul says good night. Good night, Paul. 38% efficacy. Let's do a bit better for Dr. Bean. Yes, absolutely. Embol. I haven't seen Embol for some time. We don't know exactly what the body exactly targets with the natural virus. It may be different from the vaccine, and the vaccine could trigger something new. Yes. So that is what I was saying, that it is possible there is something in the virus vaccine. Amy, hello. Cool. So let's see if there is any new question, and then we stop. Yes. So thank you, everyone. Margaret, thank you very much. So thank you, everyone, for today. Thank you for your super chats. Thank you for your chats. And stay safe and healthy. Please like, subscribe, and share. Even if you think it is long, just like and subscribe and share anyways. And if you would like to support this work, there are 3 links in the description. One is for the Patreon, one is for buying me a coffee, and one is if you just wanted to support my work. With that, thank you very much, and I would see you tomorrow. I'm just going to read this comment from Roman. If a non-vaccinated type 1 diabetic showed positive on serology IgG test, did they have wild virus? Yes. How long will IgGs show? Do they need the vaccination? So again, because this is this is type 1 diabetic, and it is possible that in diabetics, the immune system goes up and down all the time. So for them to have a vaccine is not a bad thing. Now, if the IgG is present, usually IgG goes up in the active infection. So for example, let's say if I actually had the COVID, let's say I have COVID, I am in day 6. About 7 days to 14 days is the window in which my antibodies should start getting produced. Some people even later. Maybe I'm in those some people, it may be later. So IgG's presence usually means it happens in the active disease as well. And then what happens is the disease is controlled by these antibodies, and then antibodies stay up for a couple of more months, and then they go down. So that means at least within 2-3 months time, person had the infection. I would say towards 2. So they may have the infection right now and they're fighting it, or it is about 2-3 months. Then the levels go down. There is still IgG present, but the levels are down. And that simply means it was 3 months and before. So that is how to see it. But once again, for diabetics, because their immune system modulates very much based on what is their glucose levels, it is good to have the vaccine. Extra protection. Cool. So thank you very much once again. Please like, subscribe, and share. And there are links if you wanted to support this work. I would see you tomorrow. Bye-bye.